What's the difference? How do you tell the difference between COVID-19 from the flu?
Well, they're both viruses, but they do have several differences. Most important are going to be clinical differences. A lot of the symptoms are overlapping. With the flu, you can have respiratory symptoms, and depending on the strain of the flu, you can also have GI symptoms, gastrointestinal symptoms such as diarrhea, nausea, and vomiting. Initially, most reports were saying that COVID was only giving upper respiratory symptoms and rarely was giving symptoms like diarrhea. But now we're reading more and more that that is a common symptom with patients with COVID-19 infection. Other differences, the flu virus incubates for about 3 days compared to COVID-19, which we think incubates for 5, maybe 6 days. And during this time, patients with the flu are infectious. This is one of the ways that the flu spreads so easily around the world, is that people don't know they have it and they're very infectious for those 3 days until they develop symptoms. COVID-19, we go longer with the incubation period, but the current thinking is that we're not quite as infectious until we develop symptoms. So there is a difference between the viruses in that regard. With the flu virus, the patient population most at risk are children, pregnant women, immunocompromised patients, and elderly, those especially with other comorbidities like diabetes, high blood pressure. And then with COVID-19, the most at-risk population are going to be elderly patients with other medical issues such as diabetes, high blood pressure, and especially lung issues like COPD, and those are the history of smoking.
Flu has, at least so far, lower mortality, right, than COVID has shown so far. But the infectivity of flu, they call the R0 factor, is much lower than the corona is at this point also. And, although we've been seeing corona in our communities for a long time, this mutated RNA virus is clearly something we have not seen before. And so when flu mutates, which it did, like in the Spanish flu in 1918, H1N1, it still can be pretty devastating. But typically, I think flu epidemics have spread at a slower rate than this pandemic, basically. So a lot of these efforts are obviously, as you guys know, are to buy us more time. If we can buy time, slow down the sickness rate, hospitalization rate, mortality rate, it will allow us to better prepare. Hopefully better testing comes in, more medication choices come in, more protective equipment comes in, and more ventilator beds and stuff are available.
Mortality rate is determined to be for COVID. It seems like it's always changing. That's mostly because we don't know who all has had it. Whereas with the flu, we have this mass ability to test people and know who was positive and who died and who got really sick. And with COVID-19, we know people that die from it. They all end up at the hospital at some point, but we don't know how many people have had it. So we can't calculate accurate numbers currently.